We are a private hospital group in Spain. We have 12 surgical hospitals and we have 15 outpatient centers. Last year, we estimate that we have served around 1,500,000 patients in Spain. Macquarie Asset Management invested in Viamed in October 2020. This was previously a family-owned company, and we've been going with the help of Macquarie through a full-on transformation.
Our thesis here is we're not going to be able to teach the business anything about the provision of healthcare to patients. The quality of care towards patients is formidable. But what we do bring is a whole wrap to that in terms of how you should assess risk management, how you drive an agenda around ESG in particular, how you drive safety in terms of cybersecurity, and how you actually drive these businesses to decarbonize over time.
In the last 3 years, we have basically doubled the size of the company. This has been through a combination of organic growth and also some additional acquisitions, some bolt-ons that we have been doing according to the strategy that we defined together. Macquarie Asset Management has the ambition that all its assets will be neutral in Scope 1 and Scope 2 emissions by 2040. We have in fact increased that ambition for ourselves and we aim to do that by 2030.
We have a number of initiatives driven at the board level through us as a shareholder to be able to decarbonize this asset as quickly as possible. One of the initiatives on the rooftops is to use solar panels to reduce our needs from drawing from the grid and be able to be as self-sufficient as possible in terms of what our electricity generation needs are.
So when we were looking into ways to reduce our CO2 footprint, we thought that an interesting idea would be to create an hydrogen plant where we can use the hydrogen in our hospital for heating purposes in winter, or for warming waters around the year. But then as we were going through the project, what we actually found out, which was very interesting, was that the byproduct of the hydrogen generation is oxygen, and it's medicinal grade oxygen. So we are actually going to be able to use it once the proper licensing is in place, because this is very innovative. It's the first hospital in Europe where the oxygen from the hydrogen production will be used as the medicinal oxygen for our patients. One of the things that we have been doing as part of our strategy is to reinforce our medical equipment. Being at the cutting edge allows us to reinforce the brand. One such example is ZapX. ZapX is a radiosurgery equipment that is very innovative and very recent. In fact, we own the only machine that is either in the public or private in Spain and in the whole of Southern Europe. This would not have been possible without the agreement and the overall support, both on strategy and financially of Macquarie.
We're very pleased with what we've done to date because it's allowed us to reinforce our position in the local jurisdictions where we already had presence. I think the piece that's missing is expanding beyond our regional presence today and creating something which is a much more national base. And I think that would be something transformational, which is probably the next step in the journey.